Welcome back, everyone, to MedEd Matters. Season 2 is well on our way. I want to welcome you all back to the podcast. As you are aware, we are in our series of exploring health equity in 21st century medical education. I have my co-host, Dr. Abhishek Shripad, here with me. Hi, Dr. Shripad, how are you doing?
I'm doing well. How are you?
Awesome. I have two amazing guests here with us today where we're going to be talking about teaching advocacy in 21st century medical education. We have Dr. Clayton Alfonso from Duke University and Dr. Amy Bryant from UNC. How are you all doing this evening?
Doing well. Thank
Yeah,
you. Thanks for having us.
I will
yeah.
let
Thank
the
you for having
guests,
us.
absolutely. I will let the guests introduce themselves. Dr. Alfonso, why don't you tell us a little bit about yourself and what you do clinically?
Sure. My name's Clayton Alfonso. Like Omar said, I am originally from Louisiana, but I've been practicing here in North Carolina for 12 years at Duke. I am a general OBGYN by training, and so I do both obstetrics and gynecology in a low risk setting. I also do complex family planning, and then I also have a special focus in LGBTQ plus healthcare here at Duke.
Awesome. Dr. Bryant, who are you?
Hi, everyone. So my name is Amy Bryant, and I am an associate professor in the Department of OBGYN at UNC, and I'm our division director for complex family planning. So I did a fellowship in family planning and at UNC, and I've been on the faculty now for quite some time. I've been at UNC for 16 years. And I'm our fellowship director for complex family planning. And I also work with medical students quite a bit as the head career goal advisor for people going into OBGYN.
Awesome. So, for our listeners that may not understand what complex family planning is, Dr. Bryant, can you tell us a little bit more about what that is and how does that intersect with advocacy?
Mhm. So, complex family planning is the subspecialty of OBGYN that focuses on all aspects of contraception and abortion. And so, in the most complex cases. So, that means that we take care of the patients with either the most complicated pregnancies who are needing abortion care, or for people with complicated medical problems and needing either contraception or abortion care. So we do are a 2-year fellowship that helps people who've graduated from OBGYN residency get more subspecialty training in this clinical care and also in research and advocacy around family planning, because as you probably know, family planning is a one area of medicine that's very much under threat from restrictions around abortion and access to abortion and contraception. So advocacy is very much a part of what we do to help care for patients who need our care.
And Dr. Alfonso, can you talk about how, in your practice, what do you do and how does advocacy work in your practice?
Yeah, so like I mentioned, I do general obstetrics and gynecology, but I do a lot of gender affirming care. So as a gay man in healthcare, I love to make my office a very accepting place. And because of that, a lot of trans and non-binary people come and see me for either the contraceptive needs or a lot of times gender affirming surgeries. So in addition to what Dr. Bryant had talked about, I do the complex family planning work as well. But then I also do this bulk of my surgical care being gender affirming cases. And so advocacy intersects in that in getting insurance approval for these cases, allowing patients to continue their hormone therapy, getting them resources to access counseling, therapists, and just in general, a lot of advocacy from an institutional level to teach others how to care for these patients in a non-judgmental, accepting, and affirming way. I think this, I hope today through this podcast, we talk a lot about kind of institutional level advocacy, but as well as like national advocacy, because the way to attack those is very different from one another.
I love that.
Yeah. And, you know, the work you do is so important, and we definitely want to get into that, and we will. But first, you know, I think it's helpful to kind of take it back to the start and talk about maybe how you guys became involved with this calling. You sort of alluded to it in both of your answers. Dr. Bryant, maybe I'll start with you. Was there a moment where you realized that advocacy sort of needed to be a part of your career, or walk us through sort of how those first
Yeah.
for you?
Well, I think I went into medicine. Oh, I mean, I always grew up through my church and my school and my community with social justice as a very important value. And so I always knew that I wanted to do something that would somehow, be involved in promoting justice for people around in whatever career I ended up in. And I really realized as I was seeking out my career that medicine was an area where I could both have a really meaningful relationship with individual people, but also be able to use my voice in a bigger way to be able to affect change and be able to have an impact on public health and on healthcare in general. So I would say that I sort of knew prior to going into medical school that this was something that I wanted to do, but I had no idea what it was actually going to look like. And I think that different opportunities that came up through residency and well through medical school and then residency, and then living in North Carolina and realizing when I was, in in 2011 when there was a lot of threat to abortion care in North Carolina. That's when I really realized that, oh, I will absolutely be using my voice as an advocate in North Carolina to try to stop or try to ensure that people have access to abortion. And I can talk a little bit more about some of the other pieces of that and how that came to be because I was also a part of something called the Leadership Training Academy, which is put on by the Physicians for Reproductive Health, which is a really important organization that trains physicians in advocacy. And I did through them, it was in 2011 actually, I did a whole leadership training that included media training and how to talk to legislators and other pieces of how to be an advocate. So I think there are some really concrete learnings there that I would love for students to have more and residents to have more knowledge about.
Yeah, absolutely. It sounds like the demands at different points really have shaped how your careers looked. Dr. Alfonso, what about you? Was there sort of an aha moment that you realized that advocacy needed to be a part of what you do?
I think it was kind of less planned. I will tell you that my biggest mentor was Haywood Brown, who was a previous chair of OBGYN at Duke and was a previous president for our National OBGYN Society, the ACOG. And he tapped me probably in 2015 and said, "Hey, Clayton, I think you'd be really good to get involved in ACOG on the state and national level. I think you'd be great. You've got a lot of opinions and a voice, and I think we'd enjoy having you around." And so I went to my first ever Congressional Leadership Conference. So this is a conference that ACOG puts on every year. It gathers somewhere around 600, 700 OBGYNs in Washington, D.C., and we talk about typically two topics of bills that are current, whether it's maternal health, whether it's reimbursement, whether it is contraceptive care. I think we've talked about like including pregnant people in research studies. And we learn for 2 days about the topics. We learn how to talk to our legislators, and you actually go on the Hill and meet with staffers and legislators that are that you're a constituent of and that other people of our delegation are constituents of, and you learn so much. And it was so intimidating that first year. And then I realized that we are the experts. We have the knowledge to tell these people kind of what it's like on the front lines. What are our patients saying? How does this bill or bills impact us? And I never thought I was going to love that aspect of medicine, and I took to it like a duck to water. I was just totally enraptured by it. And some of that is because my husband's a political science major and junkie. And so when I was talking to him about it, that got us in a very fun conversation about politics. And then I realized the more I did that every year, the more I wanted to be involved in this organization and in advocating. And so then I got more involved in state leadership here in North Carolina for our North Carolina section of ACOG, started coordinating more kind of local events, lobbying at our state house. And then the more I got involved in gender affirming care, well, then ACOG had me on their media list. I've done so many media interviews, news interviews, and I realized that advocacy is a necessity in medicine, just like people getting routine screening, just like people coming in and getting access to care. If we aren't advocating for our patients to continue to get access to care, then who is? And so I think in order to be a good clinician today, we have to fight for our specialties, we have to fight for our patients, and we have to teach this. We have to make sure our young learners who have a lot of energy and a lot of passion have a way to harness this in a good, effective way to make change.
So you bring up a good point. You said that we have to teach our young learners this, but how do we teach this? So, I'd be curious to know from either you or Dr. Bryant, how did you guys learn advocacy? Um, and if you didn't, how would you teach?
Well, I think, I mean, I mentioned that I was able to do the Leadership Training Academy through Physicians for Reproductive Health. And I also have since that time been trying to teach this to students. And I think one really important aspect of teaching advocacy is understanding all of the many different levels at which advocacy can occur, which Dr. Alfonso had mentioned. But basically, you can think about, advocating for individual patients by, trying to make sure that they get, their prior authorizations or the correct medicine that they need to get or access to or within your clinic to care. And then you can look more at a clinic level and take it out a little bit further. And Dr. Alfonso mentioned, for example, like advocating for making your clinic a safe space for patients to feel comfortable in. Beyond that, you can look at clinic leadership. You can look at your institution, your entire, like if you're within a hospital or a clinic system. And then you can look at your county level and your state level and the national level and beyond. So there are many different points at which a resident or a medical student can enter into advocacy, where they can make a difference for somebody's life. And I think it's really important that that we focus on why we're doing this, which is really because we want the people that we're taking care of to get the best care they can possibly get. And we have to keep our eyes on that and try all those different levers to try to ensure that happens.
Yeah, and in regards to learning it, it's kind of trial by fire, honestly. Like certainly there, like Amy mentioned, there are structured courses you can take in order to learn how to be an effective media interviewer or how to write an effective op-ed that's more likely to be published. Um, but I think what intimidates a lot of people is you feel like you need to know the answer. And I think advocating is just telling stories. It is telling somebody why something is not currently working or why something else is more evidence-based or more equitable, and then letting the policy people try to figure out the best policy to achieve that. Because I will tell you, first and foremost, I don't know anything about writing a law. That is not what I trained to do. I don't know how to do that. So when I'm talking to a legislature, I'm telling a story about how that law impacts a patient, because that is what I'm an expert in that if let's say if you cut Medicaid and reimbursement is down and private clinics close and hospital closures, then we have more maternity care deserts in the state, which increases the how long people have to travel to get obstetric care, which can increase complication rates because they have less access to local care. And so telling that story might help a legislature realize, oh, well, maybe we shouldn't do A, B, or C because, Dr. Alfonso came and talked to us and said that this is the outcome if we do that. So let's think of a different policy, right? So it's more about not actually fixing the problem sometimes. Depends on where you're talking to, but a lot of it is more just educating people about what the impacts are and what the actual on the ground stories are. And so while I didn't do any formal training in advocacy, I talk to patients every single day and hear their struggles about, I didn't have money for that medication you prescribed, or oh, I had to take an Uber to clinic today because my car broke down. And, those local struggles impact patients. And so I go and tell those stories, and that's the best way that I can move the needle. And so I think it's intimidating again while people are first getting started, but really you're just being a content matter expert and then hopefully letting the professionals try to fix everything.
Mhm.
I
I
think
want to step back for a second and put on my education nerd hat. And so for program directors, residency program directors, fellowship program directors, there is something called ACGME competencies. And so two of the competencies that automatically come to mind when both of you are talking are systems-based practice and practice-based learning. And also the other concept of role modeling comes into play. And so for us as faculty, when we are engaging with learners on whatever level, um, just like you were saying, in telling patient stories or doing that prior authorization, like Dr. Bryant was saying, or, you know, identifying what is not working in your system, we'll tell the learner exactly, I'm not just here to learn like the intricacies of pathophys and all that stuff, but I'm here to understand exactly what is the function of being a physician in today's mercurial education, medical world, what have you. So I think that's actually a really good point to point out directly to our folks that are thinking about either managing a residency or a fellowship where we're actively doing it. How can I really use my current curriculum and advocate for, lack of a better word, advocacy throughout the entirety of the curriculum?
Mhm.
Yeah, and I'll piggyback off that and just to ask Dr. Alfonso and Dr. Bryant sort of how you feel like teaching advocacy maybe has changed, or if it has changed in the last, let's just say 5, 10, 15 years, changes in legislation, structural inequalities, practice settings, new generations of learners. It might be helpful for listeners who have learners of different levels and ages and exposures to maybe have a couple of takeaways of things that may have shifted over the last several years and how to approach that.
In my experience over the past 12 years of being a physician, when I was in residency, I don't feel like people were looking for this. And that was just 2013 to 2017. I really didn't feel like our residency program was talking about it. I think everything was status quo and like the Affordable Care Act was still fresh. And so there wasn't a whole lot of advocacy. And then I think with changes in administration, the Trump election in 2016, the Dobbs decision that overturned Roe v. Wade, I think people have now wanted to be able to channel that energy of change into something different. So I see a lot of my young learners now wanting to say, how do we fight against these things that we don't agree with? And previous to that, I think people were just like making things work, not really talking about how do we fix problems, but kind of just working in the problem itself. And now this younger generation really wants to be very involved and have a lot of energy, and we need to harness that energy into a most effective way to seek change because otherwise you're just screaming into the void without really affecting anything. And so I think that's the biggest change I've seen in medical education is just like a big desire by young people to want to do this. How do I become an advocate? What can I do in order to better, patients locally, nationally? I don't know if Dr. Bryant has anything different than that.
Yeah, no, I would agree with that. There's definitely much more interest in advocacy these days. But I will also say, I think that unfortunately, I have seen medicine become much more politicized over the last, decade or so. Whereas before, I felt like, abortion has always been controversial and there's always been some, uh, attempt at restrictions and things like that. But we've seen that expand to other areas of healthcare now. So now trans care is under attack, and there's more there's more threat to, say, vaccine access and things like that. So I have seen more and more this politicization of healthcare. And so I think it is really important. Like everyone can have a role in ensuring that people understand the evidence around healthcare, around different aspects of healthcare, and that they can communicate well about that. Because I think ultimately our patients really suffer when legislators, whether they're, misguided or misinformed or somehow also, somehow like unkind about these things. But I think there's a lot of misunderstanding that leads to bad legislation that then really has real life harms for people.
Yeah, totally agree. And so, Dr. Brian, what would you say to that trainee that says, I'm exhausted. I have I have a lot of things to do. I've got a giant surgical caseload. I I don't really need to know about this. Just please teach me how to do a hysterectomy. Teach me how to just deliver a baby properly.
Well, I would
Why do I care?
Yeah, I would say that you should care because you absolutely want to be able to continue to do that care. And it is terrifying to see the things that are happening right now in our country where people may not have access to maternal care, where legislatures are shutting down hospitals across the country, and you may not, like your patients are really going to suffer. I'll also say, do not put the stress on yourself that you need to be a top-notch advocate during your training. That is not true. The road is long. We need everyone to be involved in this. So pace yourself and know that there will be opportunities. And when you're ready to step up, you can do that. My mentor, Dr. David Grimes, said, I've never regretted getting involved in like lawsuits and things like that. So that is something that has always stuck with me, that I feel like, I've never regretted standing up for my patients or doing something that I knew was the right thing to do. And you can do that now. And there's plenty of time throughout your career to also be the one as you amass more experience, as once you do have a certain level of training, it will be there for you, and you should just be open to
So jumping off of that, well, I appreciate you telling me that, but
it.
how, Dr. Alfonso, how are these skills going to support my long-term career? And there's so many issues that physicians are confronting in today's healthcare climate. How is being an advocate and or having these skills going to contribute to my well-being as a physician?
Well, I think it depends on how you define well-being. And so if your well-being is feeling like you did the best for your patient every single day, if that includes calling their insurance company and advocating on their behalf at the end of your long clinic day, you may go home feeling better because you got someone care that was previously denied. If I do most of my advocacy time on my free time because it actually makes me feel good. It is my like well-being as a person to feel like I am doing good for society. And I recognize that not everybody has that time or that passion. However, advocacy intersects every single thing you do as a physician, whether that is vaccine access, whether that is screenings, cancer screening access, if that is contraceptive access, maternal care. We've seen everything down the line be impacted. And so as a trainee, I think I remember working those 70 to 80-hour work weeks where there is nothing I could put on top of my plate. And I think Dr. Bryan mentioned it's a long road. Your career is long. And so I would agree that I didn't get really involved outside of a handful of meetings in residency until I was a faculty member. And most medical societies on the state level and local level do have some sort of advocacy class or like a advocacy program or an advocacy day. And so I think if you're looking for a conference to be able to attend as a learner, that is a great way to go and network locally, especially if you plan on staying locally, potentially meet with some legislatures, and just you don't even have to be one to talk a whole lot about telling stories. You can just go see what it's all about. And I think that's an easy way to get some firsthand experience as a learner. And then those skills, somebody told me once that like these skills are not just used every single day with lawmakers, but I use them with patients. The ability to have a conversation with someone where you may not see eye to eye, but you have to keep a rapport. And how many times do we have patient encounters where we may not agree with some of their healthcare decisions that they've made, but we still at the end of the day have to help them make the best educated decision. And having an effective conversation in that room, learning how to have positive disagreements in a space where today we're so polarized in conversations because you're either on side A or side B. There's no gray area in between. And if you're not with me, we completely disagree. We can't be friends. And in patient interactions, that's really not how things work. And so learning how to have that conversation um, in a mutual, respectful way, I think goes a very long way and has really made a difference in my ability to see patients where they're coming from. And so that's what I would tell that learner, Omar, is that like even if you're not going to go to a state house, and even if you're not going to tell a legislature point A, B, or C, that learning really helps in day-to-day patient encounters. And medicine, as much as we don't like it to be a business, is a business. There's going to be people you have to talk to that are your superiors. If you're in private practice, how to run a business, and having those conversations with people where you may disagree are can be incredibly hard to have. And so, learning how to be an effective communicator is great for like just lifelong skills.
Great.
I
And
would also say we each have our very own unique contributions that we make to our field and to the world. But if you have that little seed inside of you where you feel like this is something that I feel drawn to or that I would, that I could eventually like be a part of, then I say water that seed because it is something that can really grow. And I have found immense gratification from the community that I've been able to build, the people that I know across the state and across the country from doing advocacy work is just really, it's really meaningful to really be working together towards trying to build a better world. And so and it may not be your thing, but if it is, like explore more and seek out these opportunities because I think you will find it to be really gratifying. And we really need you. We need
Mhm.
all of us to do as much as we can to try to keep access there for all of our patients for whatever aspect of healthcare it is.
so, I'll continue the role playing exercise here. Dr. Young, was our resident on service, and now I'm his friend. I'm coming on, and he told me all the wonderful things you said, and I'm motivated. I want to learn how to do a hysterectomy, but I also want to advocate. So, Dr. Bryan and Dr. Alfonso, what are your two top current priorities? Where should I really look at my focus and perform all the things you said in terms of getting exposure, learning to tell stories? What are your two top current priorities? Maybe we'll start with Dr. Alfonso.
If we're thinking about advocacy priorities, man, it's hard to pick two because there's so many. I feel like, just I went into OBGYN because I loved, you know, uh, obstetrics and gynecology, surgery, contraception, long-term relationships with patients, delivering babies, I think was great. I couldn't do it without abortion care, of being able to care for a patient in any aspect that they come in. One of the things I think is my biggest pet peeve, and I know we keep saying access. Honestly, I think the hard part that I see is, and my number one kind of advocacy thing is going to be a kind of like Medicaid access. I think, just patients being able to walk in the door is probably the number one advocacy thing. And so when we have this big gap in access, where you have people who make right in the middle, not enough to qualify for Medicaid, but have a job that doesn't have enough employees to have a health insurance plan, or have one of these catastrophic high deductible plans that really doesn't cover anything until you hit like $5,000 in expenditures. It's always those people in between that get hit the hardest. And when legislatures are making their budgets, it's always those people and then the people on Medicaid that get the brunt of access taken away from them. And we know that emergency room care is more expensive than primary care in the clinic. And so every time we take dollars away from people to be able to access clinic services, we hurt the overall healthcare system. And in us being one of the only developed countries without some national standard of healthcare that everybody gets, is still, I think, a big detriment to the United States. And that fix is a long way away. I think the Affordable Care Act was a big attempt to help move that needle, and we've seen it kind of everybody trying to move that, or at least the conservatives trying to move that needle further and further away from equal access. And so that's always going to be my number one advocacy point, is like people need to be able to walk in the door and access care. My other one, and my bigger pet peeve, is going to be my gender affirming care patients. I think they are a population that we know in adolescence and adulthood, when they are not able to seek care, they have significantly high rates of depression, suicide attempts, suicide success, substance use disorder, and other difficulties with housing, with sex work. And so getting patients care has been shown time and time again, allowing them to have hormone therapy or surgical therapy will allow them to hold a job, have income, a lot of times not be unhoused. And so advocating for those patients to have basic healthcare services for themselves in an affirming space. Um, and I could go on and on about all the different aspects of my career that I see, abortion access and things like that. But I think my two things that really get me is just access in general. I think everyone needs to be able to get healthcare without having to worry about whether or not they're going to be able to pay their other bills. And then my gender affirming care patients hold a special place in my heart, just as a gay male in society. That's just giving back to people who have like sacrificed themselves for me over the past 60 years of the, modern gay rights movement.
Okay. Dr. Bryant?
Yeah, I mean, I would agree with those. I think access to healthcare is just in general, through Medicaid expansion, through subsidizing premiums through the Affordable Care Act. Those are extremely important points of advocacy that we need to be fighting for right now. I, of course, as a complex family planning subspecialist, also think that we really need to recognize the importance of abortion as healthcare and the role that it plays both in preventing maternal mortality and allowing people to live the dignified and valuable lives that they're leading. That it means it is absolutely integral to having any form of social justice or reproductive justice in our society. So I think we need to be paying attention to all the different ways that we are able to advocate for people to have the children they want to have and not have children when they don't want to and live in safe and sustainable communities.
And then I think my final thing, I'm going to jump in with a third thing, even though you didn't ask that, Avi. Um,
You can only have two.
no, we're gonna have a third today. And Amy mentioned this earlier, the politicization of medicine. I feel like that's the other thing that everyone can advocate for, right? This isn't f- facts are facts, and facts can be inconvenient and they can be convenient. And I don't think the current place of saying things like Tylenol causes autism, right? We've all seen the current administration put that out there, but we can cite so many studies that do not show that, and yet that is now on the CDC website. That so they're just ignoring the facts of done research studies. The when we talk about vaccines causing autism, how many times have we approached that since that article has been revoked for falsifying data, right? How many times have we restudied that data, looked into it, reran studies where it shows that like that linkage is not there, and yet still to this day we're having to fight that. And initially, it used to be just fighting it in your exam room with patients um, coming from different backgrounds or different sects of society. And now we're having to fight it on a national level where other countries are looking at us and going, what are y'all doing? And that, like, having to be an advocate for things that have clearly been proven otherwise is so frustrating, but also so equally important. And so I think when we talk about learners from all subspecialties, this impacts everyone. When your national organization, when national politics is cutting funding for research, is cutting your access to be able to get into clinical trials, is um, spelling, or spewing misinformation and blatantly lying about data. Like this is going to impact you in any field you can go into on the long term. And so I think it's important for us to be able to call those people out if that is your vibe. Like if you want to get, whether or not you are a social media influencer, want to do a media interview, write an op-ed, go and talk to a member of Congress. I think you have to find your outlet, but I think we all have to speak out, because the more we don't speak out on these things and truly advocate, the more we allow this false narrative being painted to continue.
The MFM in me is screaming right now, uh, because I have to have these conversations about what I think are foundational tenets of modern medicine on a daily basis. And so I just allow patients to articulate what their perceptions of what they have seen on TikTok or Instagram or whatever your favorite social media is. But this is important for us in training programs or who are administering training programs to ensure that people are being taught evidence-based medicine, number one. And number two, how to evaluate that evidence and adapt it to your current clinical practice. And I think that's supremely important across all specialties, utilizing journal clubs, utilizing textbooks. It's a novel concept of opening a textbook these days.
Mhm.
But I think it's really important that we really understand that we are, and I tell this to my patients all the time, I am not here to tell you what to do. I'm just here to make sure that you are going to making the best decision for yourself. You're the one that has to live with your choices. I said that to a patient once, and they said, "Oh, no one's ever said that to me before. You should probably use that for everyone else."
I think that's an excellent example of modeling too, which I think is one other way as educators that we really need to help our learners learn, like by showing like how do you interact with and it might be role playing or it might be like actually being in the room or listening to how they talk to someone, but really like when someone comes to you and says, "But I saw this on TikTok," like how are you going to respond to that? And what are, what kinds of tactics will you use? And that's an excellent one, Dr. Young. I'm going to use that.
Yeah, I think that's great. And the thing I always tell people when they see social media is who said it and what was the intent behind the message as to why they said it. And the last thing is, are they trying to sell you something while they say it? And I think you can evaluate a lot of things on social media in that way of what's the angle of the person? Is it truly just education? Or if at the end they tell you, buy my supplement, it's going to fix all your health problems, well, maybe you should be skeptical of the person that's making money and trying to sell you something. But if it's truly just to give you information, I always think, who is it? What is their educational background? What are they talking about? And what are they trying to inform me about? And so I think that's the same thing, Omar, that you had mentioned is like, I'm not here to change your mind about everything. I'm here to give you the evidence-based answers that I can give you or the opinion, the facts that I can give you based on how I interpret the data and in outcomes that I've seen, and then allowing patients to make that best decision. And in social media where everything is given to you so quickly, right? You can doom scroll for 30 minutes and man, you can get so much information depending on what your algorithm is and what the social media platform is. And so patients come in with a lot of preconceived uh, information about different topics, especially in OBGYN. And so it's important for us to be able to have that conversation because it used to be, I think I heard a lot of, oh, well, my mom told me this or my grandma told me this, and that's why I don't want to do A, B, and C. And now it's, oh, I did my research and I asked, oh, what was your research? And a lot of times you hear it's, oh, I was on TikTok, right? And so like, how does that interplay? And so having that conversation is important.
So much that emerges from all of what you said is sort of being poised and having a plan as advocates in different spheres of where you may find your advocacy being called for, whether it's on social media, in front of a patient, in front of politicians. So, informing that type of plan, if there is a junior learner or medical student, resident, fellow, even, junior attending, what would you say is kind of like the first concrete step to almost like developing your advocacy identity? You've mentioned, both of you guys have mentioned conferences, ways to approach it, ways you guys have approached it. Is there one sort of concrete step you would advise people to take in sort of developing their advocacy identity?
I would say find what you enjoy or find the one thing that bothers you the most that you feel like you'd be happy to try to fix. For me, it is a lot of reproductive LGBTQ healthcare. And so I know if I am talking to someone about contraception, abortion, gender affirming care, it's going to make me feel good. But if I have to go in the weeds talking about something I don't know about, then that's probably not going to make me feel good at the end of the day. Well, hopefully it will, but I'm probably less likely to want to repeat that if it's something I don't have an interest in. So the first thing I would tell you is find what your interest is, and really try to figure out how to hone in on that, whether that is I have an interest in dispelling false information with my patients. How is it best to do that? Versus I want to go talk to a politician about how to gain, contraceptive care to all of my patients. How can we write a bill that helps to do that? So I think it's finding what makes you want to do it is probably going to be my first big step.
Mhm. I
Dr.
love
Bryant?
that. I think that is really key. And I think there are a lot of organizations that want you to get involved in them. And that could be, there are a lot of ways that medicine is very cross-disciplinary too. So it might be that it's a medical organization like the AMA or ACOG or Society of Family Planning. It might also be something like the National Health Law Program or another more or an organization that works on like legal issues or immigration issues or LGBTQ issues. But I would say find what what you are most interested in. And I bet you that they will have some sort of program that is meant for you to try to reach out. Many organizations really want to build up their cadre of effective advocates. And so I would look into what opportunities they have available, what sorts of trainings they might have, what sorts of programs and scholarships and things like that. The other thing I would say is going back to this individual thing is that you can right now, tomorrow, be an advocate in your clinic for your patients, meaning like you can help advocate for them to have the best information by and remember that part of that is treating your patients with the utmost compassion and not putting them down for watching TikTok or not like, somehow like getting into some sort of argument about them, but trying to really understand where they're coming from and why they're believing this information and trying to help them in the kindest way possible to dispel it. Or make their own decisions that they need to make for themselves. And showing that respect, I think, is a really important part of starting your advocacy journey.
And like we mentioned earlier, we had talked about modeling, right? So in our academic centers, I think it's important for us as faculty to model good behavior, right? Like I don't love doing a prior authorization, but when I get a request for a prior authorization, I talk to my learner, if I have a learner in the room with me, about why it's important that I actually do this prior authorization to try to get that medicine, right? And so in the long term, an advocacy fight may be going, finding ways to go to that insurance company and try to change their policy. But in the short term, making sure the patient gets the best medicine or best surgery for their condition is very important to me. And so, yeah, I would love for there not to be prior authorizations, but until that's changed, modeling that behavior of, yeah, on top of all the other things, this is a part of medicine right now in this day and age. And that is important that we model that. I just think it's important for learners to see that sometimes the business of medicine means doing things that nobody really wants to do that's outside of true practicing medicine and then advocating for the change on top of that. Or the other thing is, if we look at trust in physicians in society over the years, we've been falling, right? Especially since COVID, trust in physicians to the general public has been going down. And so I think one of the ways we can do that is be seen, be heard, actually speaking to patients as an authentic provider, I think goes a long way. Trying to talk about, uh, you know, relating to your patient, being able to talk to them. I've heard so many times, Dr. Alfonso, you're just so down to earth, and I've just never had a doctor who like talks to me as a human. It was always talked down to, right? Modeling that behavior is good advocacy because if a patient trusts you and you develop trust with the patient and earn their trust, they're more likely to have better outcomes. And that's advocacy right there at its heart is that is advocacy and showing someone how they can move the needle in their own life to better their outcomes. Simple as that.
I love it. So you've given our listeners and our viewers a lot of information today. And one of the things that we always do here on the podcast is tell our viewers and our listeners what is your med-ed moment, the one thing that you want the viewers and listeners to take away. So, Dr. Bryant, what is your med-ed moment?
I would like everybody to take away that your voice is incredibly important and that you can make a huge difference by really listening to patients, by understanding where they're coming from, and by using that knowledge to try to make change. And that might be on small levels and that might be on a huge national level, but don't underestimate your voice.
My med ed moment is going to be take it one step at a time. It is, if you think about the big picture of all of this all at once, it's really easy to get overwhelmed. And so I think it's all about Where can you focus and harness your energy and take bite-sized pieces of that one day at a time? Because you're not going to solve all of today's advocacy problems tomorrow. And so it is a matter of what is an achievable goal, maybe in the short term, what is an achievable goal in the next 5 years, and what is an achievable goal you hope to have for your career, right? And then I think that can go for anything that you want to do in medicine. And advocacy is the same way. So thinking about it that way can make it a lot less daunting. And then the final thing is you already have the skills. We already talk to 20 to 30 strangers a day that you've never met before and have to gain their trust. And that ability to have that conversation with people, like Dr. Bryant was talking, is where it's at. And so finding the bite-sized piece and then knowing that you already have those skills, and then it's just a matter of harnessing it.
Well, thank you, Dr. Bryant and Dr. Alfonso and Dr. Shripad. This has been an amazing conversation, and I hope our viewers and our listeners have really learned that, you know, medicine is a really complex job. Um, Sometimes it's thankless, but in the end, it's important that we do what's best for patient care. So I want to thank all of our viewers and listeners for tuning in today to this episode. Our next episode is going to be a really special one because we have Dr. Shriva is going to be interviewing me on holistic review. So we'll see how that goes. Uh, But until next time, take care and we'll see you. Bye.
Thank you.
Thank
Thanks
you.
for having us.